So finding stories, where to look. In terms of identifying impact evaluations, what we're still missing a lot are these blind spots. And what do I mean by that? Areas that are hard to reach or that have a very limited access to basic services such as water supply and sanitation. One of these examples is clearly in slums or in recently developed urban settings. In these settings, it's very hard that institutions that are in charge of supplying water supply and sanitation are having proper activities there, or are having systematic ways of improving service or delivering service. In this case, when we're trying to see slums, there are always blind spots of service. What the people are relying here are on informal services, or even relying on small providers. And what happens here is that we cannot know how well this service is provided or what are the quality features of these services. So there are clearly blind spots of service where impact evaluations can be very useful to identify what are the binding constraints of these areas, what are the institutional bottlenecks that doesn't allow government or WASH institutions to deliver service in these areas, or simply understanding in a qualitative basis what is the dynamic in these neighborhoods and these slums that are not allowing programs to be implemented effectively there. There's another example, and Emily talked a little bit about it. How can we relate the fact that we have a good quality of WASH services, but outside the households, outside the communities, in education facilities, for instance, or in health facilities? And this is important because in certain periods of life, some factors like poor water supply and sanitation can have real damaging consequences in terms of retaining kids in school. So poor water supply and sanitation, it has found that creates adverse environments at school. It creates poor indicators of self-efficacy, of self-esteem, and adverse attitudes towards the school itself. So if we have an inadequate facility in a school, it's very likely that kids will not be happy, will not feel confident, and therefore they will eventually drop out. And when we have a bad quality WASH service in a school, the probability of dropping out increases dramatically. And this has been studied both by statistical associations, but also by causal relationships using impact evaluations. Also, more ideas. We talk a little bit about the effects that WASH in general has on diarrhea. But when kids are exposed to, for instance, unsafe water, the recurrence of this disease and the permanent incidence of disease of these children would allow them to deteriorate the nutrition absorption capacity. And that can have devastating consequences over the long run. And a child that is getting sick more often, he will tend to be more often undernourished. And that cycle is reinforced by having poor access to water, for instance. Same with child development. Children that is exposed to fecal matter constantly will have a higher incidence of disease. And these diseases are more prevalent in critical ages. Then this can affect their cognitive and socio-emotional development. And that also has proven to have adverse consequences over the long run. So these are important associations that statistical studies, impact evaluations, and qualitative studies can help us identify the pieces of the puzzle that we need to know whenever we have a water supply and sanitation program that is working in terms of bringing better nutrition and child development outcomes.